And the reason I like TMCx in this program is the opportunity to mentor to the young doctors and scientists and PhDs that have got wonderful ideas. And I think what I bring is the part that they lack, and that's the business side of the business, because that's what I've been doing for the last 45 years.
I became excited about TMCx because it's what Houston, I think, has been waiting for about 3 decades. Houston has always had some of the best clinical care in the world. It's also had some of the basic research, but it has not had that entrepreneurial drive in biotechnology, and TMCx is really how that happens.
Right.
I see my role as using all the experiences that I have had, both in academia and working with Congress and the White House and federal agencies, and bringing all that experience to help these small companies navigate the really treacherous waters of early product development. And they are very treacherous and very scary, but if you know the right connections, you know the right mechanisms, you get the good advice, you're much more likely to succeed.
You know, my background, I'm a biochemist, so I know the biology, and I've worked with physicians in the past 20 years, mostly in healthcare technology, but initially as a researcher. I think I bring to the table both that clinical understanding, knowing what a physician's trying to do, what they're trying to achieve, what their goals are, and also the technology and understanding what technology can do, where we are, experience with a lot of electronic health records.
Right.
So I think I bring to, combination of that to the teams, and a good sounding board to say, is this something useful? Is this something that might work?
Approvals have gone significantly.
One of the best things that I've found so far is that the startup companies are truly engaged with the medical center community, and it is so important that if there's going to be a technology accelerator program that is meant to try to influence the kinds of technology that are at hospitals, that the companies are engaged. And having the engagement from the companies and then seeing the possibilities of what can be developed, there's real potential for the Houston Medical Center, the Texas Medical Center, to not only just be the largest in the world, but the most innovative in the world.
I think TMCx is the future of Houston. I really do. Houston is known as an oil town. It's certainly much more diverse than that, but the future really is biotechnology. And it's not just therapeutics or vaccines. The future is going to be biologically based materials that form the basis of new aircraft. It's going to be molecular biological electronics. All this could be home right here in Houston. So I really think TMCx is the start of the future for the next century, and I really believe that passionately, or I wouldn't be here.